Hello, my name is Robin Stam. I am an assistant professor of clinical nursing and the director of the Pediatric Nurse Practitioner programs at the University of Cincinnati. I am board certified as both a pediatric acute and primary care nurse practitioner. I've been asked to give an explanation of the difference between the two pediatric roles, the primary care pediatric NP role and the acute care pediatric NP role. When defining the roles of the certified pediatric acute and primary care nurse practitioner, I rely on the certifying board for our profession, which is the Pediatric Nursing Certification Board, otherwise known as the PNCB. The certified pediatric nurse practitioner in acute care provides family-centered and culturally respective care for pediatric patients with acute, complex, critical, and chronic illnesses across a variety of care settings. The pediatric acute care nurse practitioner works closely with an interprofessional team to provide the highest level of evidence-based care for infants, children, adolescents, and young adults with life-threatening illnesses and organ dysfunction or failure. Due to their unique healthcare needs, a patient outside the traditionally defined pediatric age parameters may be best served by the pediatric acute care nurse practitioner. Age restrictions, if any, are determined by individual state boards of nursing. The practitioner in the pediatric acute care role is responsible for independent and collaborative decision-making with direct accountability for clinical judgment. The pediatric acute care nurse practitioner monitors and ensures the quality of healthcare practice and assists the patient and family in negotiating healthcare delivery systems. While the pediatric acute care nurse practitioner typically works in a hospital or inpatient setting, there are instances where the scope of practice of a pediatric acute care nurse practitioner is needed in an outpatient or community setting. At UC, we offer a BSN to DNP tract for pediatric acute care nurse practitioners and a post-MSN or post-DNP certificate pediatric acute care program. Moving on into the primary care NP role. So the role of the primary care pediatric nurse practitioner is to provide care to children from birth through young adult with an in-depth knowledge and experience in pediatric primary health care, including well child care and prevention management of common pediatric acute illnesses and chronic conditions. This care is provided to support optimal health of children within the context of their family, community, and environmental setting. The pediatric primary care nurse practitioner role is designed to meet the specialized psychologic and physiologic needs of children in areas of health maintenance and promotion and assessment and management of disease processes. While the pediatric primary care nurse practitioner typically works in an outpatient or community setting, there are instances where the scope of practice of a pediatric primary care nurse practitioner is needed in a hospital or inpatient setting. At UC, we offer a BSN to DNP pediatric primary care nurse practitioner tract, as well as post-MSN or postgraduate degree certificate pediatric primary care certificate programs. I like to look at some examples, and the National Organization of Nurse Practitioner Faculties, otherwise known as NONF, has given some useful examples to help clarify the role between the primary care and acute care nurse practitioner. Both acute and primary care nurse practitioners might treat patients with similar conditions, such as patients with diabetes and asthma. However, the severity and instability of presenting symptoms might help to define the needed provider at any given time. Both primary and acute care nurse practitioners can serve as points of entry to health care, and they also collaborate with each other when managing patients. For example, if a patient presents to the ED with an acute asthma exacerbation requiring hospitalization, the acute care pediatric nurse practitioner would stabilize and manage the patient's asthma symptoms, document the patient's ongoing primary care needs, and then refer to the primary care pediatric nurse practitioner for long-term management. Similarly, that same patient could present to a primary care setting, and the primary care pediatric nurse practitioner will provide immediate stabilization and transfer to the hospital, where the acute care pediatric nurse practitioner would manage the unstable critical patient. I hope this recording helps you determine whether you have an interest in being a pediatric acute care nurse practitioner or a pediatric primary care nurse practitioner. Thank you very much.